The doctor has no objections. This vest-like garment not only takes over the monitoring of cardiac patients, but also can perform first aid in the case of acute ventricular fibrillation when the patient is not able to call for help anymore after fainting. With the built-in ECG electrodes, the device monitors the ECG constantly. It analyzes the ECG, and as soon as ventricular fibrillation occurs, it is detected straight away. The patient is warned acoustically, visually and haptic. If he still is conscious, he will be able to suppress the shock. Otherwise, the defibrillation electrodes becomes active. They animate the needed electrode gel, and then the defibrillation can be performed.
Durchgeführt werden.
If ventricular fibrillation is not the reason first aid is required, the emergency doctor or ward physician can get insight with this ultrasound device similar to a mobile phone. Much faster, easier and less complicated than with large instruments. The device operates in the conventional B mode, which means black and white images in which the echoes are displayed in form of white dots. In addition, the blood flow is outlined. In continuous operation, the device can run for an hour. But since the examination only takes a few seconds or minutes, the battery usually lasts one whole day.
In der Regel nur einige Sekunden oder einige Minuten vielleicht maximal braucht, hält in der Regel die Batterie etwa einen Tag.
The little helper costs about 6,000 euros, and one or the other internist probably will not want to ever give it up after getting his hands on it. At the MEDICA in Düsseldorf, the most advanced devices for the work in hospitals and for therapies are being presented. This is one example: compression underwear to help prevent back pain and muscular weakness.